Good morning and welcome to the GHA GDDS Strategic Planning User Group. Thank you for taking some time out of your day to join us. Today, my name is Leslie Sanovich. I'm the Senior Director of our Data Services Department, and we have Bill Wiley here with us.
Good morning.
And Sharifa is not with us today. Bill Wiley is our Senior Vice President of Business Operations, and many of you know Sharifa. She's our Data Integrity Specialist that manages and reviews all the data as it is submitted, and again, she's taking a day of PTO today. We will go on and get started. Our agenda is, as it usually is, talk about the 2018 submission review and closure, briefly review the 2019 data submission. I want to remind everyone and show you a couple slides of the readmission module. We have some discussion surrounding the strategic planning visualization tool that we would like to get your feedback on, some ideas and suggestions. And we'll do a brief demo on that, and then also have plenty of time for questions. Currently, all of the lines are muted. I'm going to unmute everyone and ask if you can hear me okay, and if you can see my screen okay, if somebody would respond.
Yes, I can hear you. Bob Bibbings in Rome, Georgia. I just can't get into the video portion. I've got some kind of click dimensions error, so, but I can listen.
Okay, you can't get into the view in my screen?
And this is Mark Hayes, and I'm having the same issue as well.
Huh.
Click dimensions.
We had an issue with click dimensions yesterday, and that could be the problem. I know that the calendar invite was sent out through click dimensions, but this is actually a Zoom meeting. I apologize. Is everyone having that problem?
Yes.
Yes.
Go to, I think what's occurring is click dimensions is adding a redirect link in there. Here, do you want to just put the link up on your screen?
Yeah, that's what I was going to try to do.
HTTPS
Hang on, I can open a new
GHA.zoom.us/J/1468.
Is that correct, Bill? What I typed, Tom?
Oh.
Could you repeat that number again, please?
Can you see that on my screen?
Yeah, I'm trying to look at 1467. 14638.
So I have it.
1467, 14638. Yeah, that's it.
Okay. I put the link up on.
If they can see the link, they can get to the. Yeah, that won't work. They can't see the screen.
Oh, duh. Sorry.
All right, so it was basically gha.zoom.us/ and then that number?
J/ then that number. Not sure what the J is, but.
No. J is in jump.
Okay, that seems to have done it for me.
Works for me too.
Great. Does anybody else need us to repeat that?
Please do.
It's https://GHA.zoom.us/ the letter J as in jump /14671468.
Thank you.
Sorry about that, everybody.
Will that change moving forward for upcoming meetings?
I don't think so.
It shouldn't, but I think there is just a glitch with the click dimensions, which is how we sent the invite out as a recurring event. But we'll make sure before next meeting that it's resolved.
Yeah. Like I said, I think it's part of the tracking that Click Dimensions does, it puts in like a redirect, and some of the some systems don't like that and will block it. But I think there's something else going on. I heard something else didn't go yesterday too.
Yeah, I didn't think about it affecting our Zoom
because it had already gone out.
Because it had already gone out. But if we need to send out an updated invitation, that we'll make sure it's tested and that it's functioning, and we'll do that before the next meeting. So is everybody good? Had a chance to get on, and we're ready to get started?
Yes.
Great.
Thank you.
Okay, so again, briefly, this is just kind of a outline of an agenda, just a guideline. Again, all the lines are unmuted, so if you have background noise, you might want to mute yourself, but we want this to be an open forum where people feel comfortable jumping in with questions and having dialogue with everyone. I like to do this. I know it's repetitive, but again, we are constantly adding new users, new employees at hospitals that are just learning about the data program here at GHA, and so I like to at least give this quick overview. The Georgia Discharge Data System is a state-mandated submission that hospitals in the state of Georgia must submit their data to the Department of Community and Public Health, and we are the vendor for that data. We have been for over a decade. We manage that process through a vendor that we have, a subsidiary of the Missouri Hospital Association, and they have been the vendor to intake the data online for, again, about a decade. So that data is submitted in the UBO4 format to HIDE, and then it is run through a lot of data checks, and different variables and data elements are added onto that, such as DRGs, geographical codes, service lines, and then that data becomes the Georgia Discharge Data System, and we submit that on your behalf to meet the state requirement to the state, to the Brain and Spinal Trust Fund Commission. We also participate in the Agency for Healthcare Research and Quality and the Healthcare Cost and Utilization Project, HCUP. So we are funneling those, any research request, data requests to the HCUP program. GHA also takes that data set and makes it available back to you through our visualization, our current tool, the visualization tool, and we use the vendor Javion, and we'll be looking at that data tool in a moment. We also have, through a grant from the State Office of Rural Health, have been able to develop with Javion a readmission module, which I'm going to spend a few minutes on later in the call, because we want everyone to utilize this tool that is at no extra charge to your facility. So again, this is just a broad overview of what our data is used for. Another point, and I've meant to update this slide, the data is also used for other purposes, for quality purposes. If you participate with us in the HIN project, we take that the data that you submit to HIDE is also run through a few queries to calculate your readmissions for the HIN program. As far as those specifications, I think there's a pressure ulcer. There's a few other measures that are defined through that submission. We also support most of our critical access hospitals through another grant for the Quality Works program. We take your UBO4 data submission and identify the patient population for inpatient and outpatient for core measures for submission. It's the chart abstracted measures for submission to CMS and those that are Joint Commission accredited. So any questions on this particular slide? I'll stop for just a moment. The other data set that is available by subscription is our limited data set, which is a quarterly release of de-identified patient-level data of all the data in the state of Georgia. So that is available for subscription as well. That is an additional fee, but some of hospitals that have their own data analysis departments and data scientists like to subscribe to that data set. So if you have any questions about that, feel free to give me or Bill a call. This is our submission schedule at a glance for 2019. Before we get to that, I will mention that we are in the final stages of reviewing and closing the 2018 data. That should be finalized by the end, mid to next week. Sharif has been working very hard to make sure where there are any gaps or inconsistencies in the 2018 data that those hospitals were given the opportunity to make corrections and update the data and resubmit. So we were still having a few last-minute submissions, but we are going to be closing that data at least by the middle of next week. And we also, Bill wanted to talk about another data set that we're going to be able to include kind of as an addendum or another release of the 2018. We're not going to hold the 2018 data up for this last submission, but Bill, can you share with us?
Sure, I'd be more than happy to. As you guys know, we've had some out-of-state hospitals that participate in this program. Aiken Regional, just outside of Augusta, is one, and that helps us fill in the gaps of any patients that out-migrate from Georgia to Aiken. We've been talking with Erlanger in Chattanooga. They obviously have a reach in northwest Georgia, and they are going to start participating and submitting their Georgia-based patients. So we're not going to have anything that they have just from a Tennessee patient that goes there, but anyone from a Georgia county that goes to the Erlanger facilities, including the one in Murphy, North Carolina. They just took that over earlier this year. So they are going to start participating and submitting, again, their Georgia-based patients only. As we were going through their training, they also use, the Tennessee Hospital Association has a similar data program, and they use Missouri, the HIDE program as well, but their file is a little bit different. So Erlanger is working on a test file, but the next time that they'll be able to submit is not until August the 20th. And we just didn't think it was feasible to hold up the final close of the 2018 data for our members any longer than that. So we are going to generate a supplemental file that will just be that Erlanger data after they're able to get their 2018 Georgia patients in, and we'll make that available to anyone that already has the limited data set subscription, and we'll post that to JVon, so it will be part of all of the tools as well. We're happy that they're coming in. I think it's going to fill in a significant gap of the patients, especially that out-migration from northwest Georgia into Chattanooga. So I think it'll be very beneficial to the hospitals that are in that area and just help us complete that picture. It's not going to be part of the file that we submit to DCH or DPH. They're not obviously subject to the state mandate. So it's just for the purposes of our members having access to strategic planning data and things like that. Going forward, they're going to be on the same schedule that our members are. But this was kind of a late addition, and they've been working on their test file, and it just didn't work in time for us to include them in our data, and we just didn't want to hold it up much longer since we don't even know if that August 20th file is going to work either. So with that uncertainty, we just thought it'd be best to close it out and issue a supplemental file. Happy to take any questions, or if you guys tell us no, it's no big deal, we'll hold it and do it all at once. We can look at that, but we think this will be the best way to get all of the data to the members quicker, and then also include them whenever they're able to give us that last file.
Thoughts, comments, questions? All right, then we'll move along. We're currently receiving June data, which is due the 15th for the Georgia Discharge Data System. I want to caveat and footnote and say that if you're a Quality Works participating hospital, your submission deadline is a little bit different, a little bit accelerated. So this is for our normal Georgia Discharge Data System participants. So this is our schedule, and it's posted on our GHA Data Services side of the GHA website. So if you need to access that at any time, it's always there for you. Wanted to just give, in Sharifa's absence, give a quick overview of the verification report and how you do review your data, and also to let you know that in the next couple of months, there is going to be an update to the HIDE submission site. They've refreshed it, added a couple of reports that we feel like will be more helpful, added the capability of exporting these reports into Excel. All the reports currently are PDF. So when that will be definitely the topic of one of our user group calls for sure, when that updated web platform or web portal is loaded. The verification report gives you a year-over-year picture or counts of your inpatient and outpatient data. It basically just groups and sums and counts a lot of the different data elements from the UB file that you submit. So you have, basic patient counts, and you can see by month and quarter, year over year, where or if there is a difference or a drop. See how to get, there we go. That you may need a drop in volume or a significant increase in volume that you may want to pay attention to. In this case, it looks like November and December haven't been fully submitted in this case, and so that's something that this facility would need to be aware of to look at their data submission. It also gives you your charges. Charges are not included in our strategic planning tool, but here is where you can see your total of charges for inpatient and outpatient and see the validity and consistency of those. And on the following pages of the verification report, it groups, and we've merged a couple of these together to just save screen space. It gives you counts by patient type, by month, year over year. I don't know why my screen keeps jumping. By outpatient as well. You also would want to look at payer. The pages following this one have the payer broken down, so you want to make sure that you have the appropriate payers reporting in your data. Then it gives a ranking of the counts of DRGs. So the report has been expanded, and it's about 14 or 15 pages long, depending on the amount of data, the volume of data that you have for your hospital. But again, we can't emphasize enough the importance of these reports, and that you have a team that reviews these reports. The person submitting the report may just be from your IT department, which is totally fine, but they are not necessarily the appropriate staff to review and verify the data. So if you need assistance in identifying who's uploading your data, we can certainly do that. We can add users to upload data. And the other thing is we'll begin a review towards the end of the year to look at how many users you have, how recently they have logged in, because we want to make sure every facility has at least 2 people that can log in. Life happens and people go out on unexpectedly or may leave your hospital unexpectedly, and we need to have somebody, a backup, that can upload your data and then have a team that can verify and review the submission. Any questions?
And this is Bill. I'll say that usually, when we've met with our hospitals, the person that can look at this real quickly and tell if it's right or questioned is the CFO. The CFO knows that that monthly census better than just about anyone. So if there's a way to get them involved in the verification process, then that usually adds that extra layer of context. Like Leslie said, we've got a bunch of filters that can make sure that the data is as accurate from a, quote, mechanical standpoint as it can be, but only the hospital itself can add that context of, okay, the volume did change by that much that quarter or something along those lines. And like I said, usually that CFO has that number almost memorized, so they can look at it real fast and see if this is reflective of what happened at the hospital.
Thank you, Bill. There are other reports available. The edit summary report is actually, as soon as your data is submitted and it has been processed, the people who have login accounts on Heidi Online receive an email with a PDF attachment of the edit summary, which gives just basic counts and also your percentage of fatal warning errors. And again, it's just a summary. You then would need to log on the Heidi portal to look at the edit detail to see specifically what patients were identified as having an error, and it actually gives the medical record number, their birth date, discharge date. It's PHI, so it cannot be emailed automatically, but there are resources on the Heidi Online, and again, when the new portal is launched, we'll give an extensive training and recording and documentation on that portal. Any questions? And I'm trying to monitor the chat if anybody is putting in. I appreciate it.
No, it's just everybody says that the link works.
Great, yeah, that's what I thought I saw. All right, well, we're going to move forward then. The GHA website has a data services section and resources. The two kind of categories are the member reports, which are some static reports that we generate or a file is given to us from DataGen, who we contract on your behalf to do analysis. Bill, do you want to speak to those? Well,
they do a lot of the Medicare modeling for us. I was going to say we have not uploaded a whole lot of files recently. This is kind of the lull in when all the policy stuff is out. They are working on all of the outpatient final rule or the PPS final rules. So I expect that we'll have a massive report dump in the next 3 weeks or so, with just everything else that's come out. So be on the lookout for those.
And then on the data services resource, that's where a lot of our forms and prior presentations are posted. You can see we've got the UB04 layout here, and then there's also, it shows also where there's some of the reports that Bill is speaking of. We also have links to a YouTube channel where we have recordings of the past user group, and this today's user group is being recorded and will be posted, in the next week or so on the YouTube channel. So if you've missed one, want to go back and listen, you're more than welcome to do that. Again, this is just a screenshot of our visualization tool. We have been working for quite some time now to transition over to the visualization tool from our previous Analytic Advantage tool with Heidi, and we're looking to enhance this tool. So one thing I wanted to get some feedback on today, it was brought up yesterday when I was in another meeting, if race and ethnicity could be added as a drop-down. What are your thoughts? I'd love to hear somebody's thoughts on adding that as another filter. We don't want to muddy up our screen any more than we have to, but we know that as you're looking at your service area, this may be a helpful filter to add to the main screen.
This is Mike, but I'm just curious with the ethnicity, how well populated the data is at this point to make it worthwhile to have it out there.
I think
think it's
fairly well done.
I do too.
I guess we can't vouch for its accuracy, but I don't think it's a field that there's a lot of gaps in.
Right. I don't either. I think it's fairly well populated, but I'll circle back around and look at that. Thank you for that comment.
Yeah, I think it looks good to have it. I just question the validity of it because I don't know how well we do in collecting it, but
No, thank you. That's helpful. Any other thoughts? I think somebody's at a football practice. There we go. Thank you. All right, so we're going to add that to our discussion. We're actually having a discussion with Javion later today, and so we'll add that to our discussion about the feasibility of adding that as a filter. Is there anything else you can think of as far as filtering on, the visualization portion of it that would be helpful? The next screen, before I open that slide up, is that I know we had talked about adding another tab to sort of bridge the gap on being able to download a set of data based on specific criteria. And so we, in working and listening to some of our sister hospital associations that have moved on to a visualization tool, come up with a sample screen, and this is going to be what we talk about this afternoon with Javion, to add a tab that actually has all of these filters at the top where you could filter on data, and then you would be able to select up to 5 columns is where we've set it currently, to export the data. So this would not produce a graph or anything visual. It would just actually be a data export into Excel or to a text file. So I'm going to pause for a moment. The automatic columns that we would add, obviously, are the counts and average length of stay, and let you kind of take that in for just a moment. Feel free to give your comments or ask questions when you're ready. We've heard from a lot of people. Now, I know we have a lot of people. When I sent the invitation out, we got about 50 out-of-office replies, so I know we may have a smaller group today. But we have been hearing some feedback from people that wanted something like this and preferred an data export over just the visualization portion. So we're trying to satisfy those needs of people, and it's mainly facilities that are not, don't have the bandwidth to import the limited data set and utilize that, but they do need some kind of data capture functionality or download functionality. So I am anxious to see if you think this would meet that, that need.
Hi, Leslie. This is Mike at University Hospital in Augusta, and I think this will be a big help for me. Our executives are used to seeing a Excel spreadsheet that I've used with the analytic advisor, or whatever it was called. I'm drawing a blank on the name of it, but the tool prior to Javion, and I keep going back to using that tool because they're used to seeing the information that way when we do our updates to the information. So this will be a huge help for me.
Great, thank you. That's what we need to hear. Anyone else?
This would be very helpful to us as well. Just being able to pull data out into Excel is going to be very useful.
Great. Well, hopefully by the next time we meet, we'll be able to have a live demo of this edition. And I also know, I think I got an email right before walking in here that the DRG filter tab, I think I got a prototype of that this morning, which literally I haven't had time to review because I think it came in around 9:30. So, you know, we're working on having this tool fulfill a really broad spectrum of people, and that's not always the easiest thing to do, but we feel like this is the right direction to support all of our members. I'm going to, before I do that, I'm going to go to our tool and show you a couple things. One, I'm going to transition to talking about the readmission module. I know that many of you may not be part of your quality team, but we have a readmission tool that was also developed by Javion, and it was funded through a grant from the State Office of Rural Health. An initial notification was sent out when Bill, early in the year.
Oh, February. Yeah, January, February.
To all of the CEOs asking for their identification of users in their facility who should have access to the readmission tool. Reason being is that the tool allows for patient-level drill down, and we wanted to make sure the CEOs were aware of who is accessing that PHI and patient-level data. So we realized that some CEOs may have gotten lost in their junk email or, put aside. We, probably only have 25% maybe of hospitals participating currently in the readmissions. Again, there is no additional charge. So if you are interested in this tool, the forms are located on the GHA Data Services portion of the GHA website. We need CEO authorization to identify those people, and once those people are identified, we send them an acknowledgement form to agree to and acknowledge that they are working with the PHI data. The people that we have been able to sign up for have been very pleased, have found it very helpful. And Bill had developed kind of a toolkit of the readmission module. It's in Word, but I just wanted to show you a couple of screenshots here of what the tool looks like. You can see here, and this is, I believe, fake data or test data, but on the opening screen, you're able to see all-cause readmission rate. And again, this will only be for your facility or facilities in your system if you have system authorization. You'll see an all-cause readmission rate, and this will be not just for Medicare. There is a number or percentage for Medicare only as well, but the all-cause is all payer. So, and Bill, please speak to the fact that these are not, this readmissions tool is not related or intended to be related to any penalty.
Yeah, this is not based on the CMS algorithm. This is strictly based on if a patient was in your hospital and 30 days later or within 30 days they were readmitted to yours or a different facility. So this will not line up with your Medicare reports and things like that. This is purely a true readmission. It's built as a quality tool. That's why even within this tool, you have the ability to drill down to the actual patient record so that you and your quality folks can go in there and go, we expected this person to be readmitted. It was part of their plan that they would come back within the next 15 days, or it was, from a nursing home back or something along those lines. So it has got nothing to do with the Medicare the quality payment program, incentives or disincentives, just depending on how you look at it. This is strictly a math equation of you had 100 patients and 10 of them were seen within 30 days at yours or a different facility, so you've got a 10% readmission.
And scrolling down just a little bit on the screen, I wanted to make sure this is large enough for everybody to see, but it breaks down the readmissions by, the number of days. So if it was after 20 days or more, or between 6 and 10 days, the number of encounters and the percentage of encounters, and then it shows that graphically. It also breaks down the discharge status, where the patient was discharged, before they were readmitted, and how that breaks down, and then again that graphically as well. It gives an overall up here of the readmission trends. I'm not sure it's in the screenshot, but there also is a drop down by condition for AMI, heart failure, pneumonia, for sepsis, for the hip and knee.
Right there, there's a select condition right above and to the left of the all-cause readmission rate.
Okay.
I think that's later in the...
Yeah. So as you can see, this has a lot of information, and we just want to make sure that somebody at each facility has a quality staff engaged and signed up for this tool. Down below here, it breaks down things by the service line and DRGs for readmissions, and then there are multiple tabs within the tool. This again breaks it down or zooms in a little bit more on the select condition. Those are the conditions that are available. Again, Bill did a really good job with this kind of help guide, and you're able to filter. All of the graphics are interactive, and you can filter in and include, exclude, zoom into a particular care service line. It works the same. It has the same functionality as the visualization tool. Also, it allows you to download, and this is the part that's a little scary at times.
This is why we don't show this part.
Right. So again, if you click on this underlying data, you're able to look at the patients, the readmitted patients, so that you can see their medical record number, and you can go into your own system and look at, the specifics on that patient's chart. On the second tab, there's a stratification, and again, you can see there's a map that shows, I think these are zip codes, Bill?
The heat map.
The heat map.
Yep.
And I just wanted to give you a taste for this so that you can, run to your quality director and say, do we have somebody logged into this or signed up for this? And we're happy to do one-on-one demonstrations with this. We're going to be working with our quality staff to kind of get this out there more and include this in some of the presentations that they do as well. I think you can see the capability of what the tool offers. The third and fourth tabs offer readmissions by physician, and we've kind of grayed that out just to not call anyone out. But also wanted to mention that the physicians that are displayed are coming, again, all this data is coming from the UB submission. And the physicians that are recorded on the UB are attending physician, the operating physician, and the third piece is at the hospital's discretion. So, it's going to be a lot of hospitalists. And
I was going to say that is where it comes down to, again, the hospital understanding the physicians and understanding the reports. Those are identified by who's on the UB, and they may not be the ones that are ultimately have kind of the responsibility of care coordination. So that's just something that the hospital is going to have to use to interpret those reports and how they interact with the physicians with them. It's not always something you can just bang the physicians and go, you need to do better at this. there could be valid reasons why their numbers are the way they are.
And then on the last tab, again, it lists physicians, but it also shows some readmission trend analysis. And again, at the top of all of these tabs, there are different filters by condition, by age, by service line. If you're part of a system and you have access to, several of your facilities, then you would be able to see, you would be able to select a facility or look at your entire system. Any questions about? I know we've moved through this fairly quickly, but wanted to give you a flavor of what this looked like.
This is Mike from Augusta. I asked the last call, is it possible we can get a list of the users in our organization for each of the tools? Because one concern I have is folks that have left, I don't know how you kind of monitor the security for that to kind of shut them off.
Well, we do, and that's one of the reasons that we have started using this click dimensions for all our communication, because it shows in a report way, not just a kickback. It shows emails that don't go through, that are unopened, so we monitor it that way. We also, from kind of the back end, we run reports to see who hasn't logged in X amount of time. So that we can clean that up as well, especially for tools sensitive that can, get to the PHI, because even the Heidi Online GDDS submission portal, there is PHI where you can get to patient level data in some of, if the data had an error on it, you will see an error in like a birthday, as I was mentioning on the edit detail report. So we are, we depend on you some too, as users, to report to us, so-and-so's not here anymore, or we get a automatic return that says, I'm no longer with. So
email address not valid,
right.
Things like that. If it's a consultant in the system, which we do allow consultants to have access on behalf of individual hospitals, their account automatically expires after 60 days or 90 days?
It depends on how the hospital.
Yeah, but even if they're active on day 59 and it's supposed to expire on day 60, it automatically expires on that next day. So some of them are just set to term from the very beginning.
But Mike, I can certainly send you a list of users of the various points of access that your facility has.
That would be great. Thank you.
Any other questions or thoughts? All right, we have just a few minutes left. I need to go back and log in. The tool, I think since the last time we spoke, has been updated with the first quarter of 2019. And as soon as the second quarter is available, we'll again have that updated as well. Just wanted to, we work with hospitals all the time and trying to answer questions for them. We had a hospital recently need to look at their service area, and so, one quick way to do that is to actually select the facility, and if you wanted to look at patient type, you could, and I'm not really picking on anybody, but I'll just choose Archibald. And I'm gonna change it to end on 12/31 just because we have that complete year of data in here. But what this does is it allows you to identify the zip codes, the top zip codes that are in their service area. And the other thing you can do, if it's a larger service area, you can actually click on the header of the number of records by zip, download the data. So it pulls up, counts of all the zip codes, download all rows as a text file and open it with Microsoft Excel. And then you would be able to, and hopefully you're seeing my screen. I'm probably moving a little too quickly here. But you could actually sort on the number of records. So you can see that patients, we have patients from out of state that are visiting, obviously, Georgia hospitals. So if we just insert a table here, and we can sort on the number of records, you can see the patient zip code here and the top, where you might want to cut it off if you wanted to go back in and filter just on those top zip codes. So if we went back in and went back to the filtering tool, and we wanted to see where patients are going from those zip codes, then you can select that one. So I'll just do 2. So then you can see the other facilities and those zip codes that patients are going to for services. It also updates the primary care or primary payer type. Bill, can you give a couple of examples of how this might be useful to hospitals?
Well, I think just in general, just to understand the patient flow from their particular zip codes and what they're going for services on. We tend to think of markets as counties, but I think a lot of the hospitals are getting very specific in zip code level and who's doing what from which zip codes. So, in this case, it would be, just to see where they're going from all the Thomasville zip codes where their primary service area.
Again, I just chose a random hospital, and you can do this on your own. But does anybody have any questions or anything else they'd like to see on the visualization tool? Again, just to show you a quick, I had somebody earlier this week ask if I'd give a quick how-to, and I'm not going to really do that today, but we're certainly happy to do that on a one-on-one basis. We have what we're really starting to learn more about is our web presentation tool called Zoom, and we're happy to do video conferencing one-on-one with you or your team sessions on the various tools and data submission programs that we have. So please feel free to reach out to us, and we even love to come and visit and meet with your team if that's helpful. So again, like I said, by the next call, hopefully we'll have a DRG tab and a filter tab for you to look at. Just keep in mind, I call all these sections on the page a quadrant. So each of these quadrants you can click in and filter on. You can click on the header and download that data grid of counts. And then hopefully once we get the filter tab in place, that will be helpful when you're just hoping to isolate in on a data set and download that and manipulate the data on your own. Any other questions? Well, we're approaching the end of our time together. We did make a decision to postpone next month's call and move it from September 4th to September 11th. So, yes, you will get an updated invitation because it will be for September 11th. So hopefully that, part of the reason we did that is it's Labor Day week. We're not sure when people's fall breaks are, if you have a fall break. And Bill and I are also not going to be in the office. So hopefully that will suit everyone. If not, again, we record these, and if you have any special requests, we really would welcome your questions and suggestions or case uses for how you've used the tool. That's one thing I would really like to hear, is how others are using the tool. And we can share that with the group, or we would certainly be happy for others to present on this call and share how they're using the visualization tool or the readmission tool. Well, I will give back about 7 minutes of your time this morning. Our contact information is there. I'll leave that up for a few minutes. Please, we're here to support you and answer any questions that you may have, provide training, provide context, but just please reach out and give us a call if you need anything. Thank you, and have a wonderful rest of your day.